Today we're here with DeLorne. DeLorne was in a car accident recently and actually suffered a pretty serious injury, especially to his ribs. You just kind of want to let us know a little bit about what happened.
Yeah, I was driving home, just pretty close to getting home, and then all of a sudden, I got T-boned, a couple of airbags deployed, specifically the driver's side one. And I believe because I was driving like this, it hit me directly in the ribs.
Yeah.
And that's what caused my ribs to be fractured.
So a lot of times when patients get fractures, not just in the spine or in the ribs, they tend to veer away a little bit from getting chiropractic care. Where here, this is actually gonna help him benefit and heal at a faster rate. And we're gonna show you how that's done here today. You ready to get started? So this is DeLorne's 7th adjustment since the car accident. So he was definitely a lot more tender when we first started working with him. But one of the biggest things that helps out with ribs, we use two major devices. Number one is going to be our arthrostem with this rubber blade. The rubber blade is actually designed for rib work because this vibration and that piece goes in between the ribs. It actually helps with loosening up the sheaths that are in between each rib. It helps them breathe better. It helps them take more pressure off when they're expanding their rib cage. And that's one of the things that's important is when they get that rib injury, patients tend to kind of collapse and guard themselves. And this can actually help with opening that up and helping the healing process actually facilitate and get better. But we're going to be really gentle. We usually use this along their spine and press hard. When you're doing this along a rib, we just want it in there very lightly along the long axis of the rib, pushing down at a downward angle on the top side of the rib. And even on the sides is usually where they're really tender, on the side of the rib cage. Sometimes we'll even feel that wrap around to the front because we have our ribs connect to our sternum here in the front. But these lower ribs will be floating ribs. Those won't connect to the front part of your rib cage. And since these ribs attach to the lower thoracic spine, doing this rubber blade in these costal joints along the transverse process really lightly, this helps with taking pressure off that joint. Feels fine? Perfect. Next thing that we use is this activator. Same approach. We kind of want to go from a superior medial to lateral aspect when we're actually adjusting these ribs. Since once again, the ribs wrap around, go into the spine, when we kind of go from this outward direction on the top part of the rib, once again, just helps with getting a little bit more motion in there. And that's generally what we'll do for that rib region. Now, since he has these fractures here, what we want to do is still adjust the rest of the spine. What we're going to do is avoid thrusting in this area, obviously, because that's not smart to do with any broken bones. But since he's probably tightening or was guarding after that accident, we still want to adjust the lower back, the middle and upper part of his spine. The biggest reason why is because of the compensation of that collapsing posture, generally to protect that rib. We're not going to be thrusting down here, so we're going to kind of stay a couple vertebrae above. So we're going to stay from here on up where it shouldn't affect his ribs at all. Are you ready? All right, so take a deep breath in and out. Nice. Good. How'd that feel?
Good.
Did you feel any pressure on your ribs at all?
No.
So now we're going to move to your lower back. Something to note, wherever the ribs are at, you're going to have to kind of work around that, obviously. So his elbow is kind of in that area where those ribs are. So when we do the side posture, we're not going to sit up on him and push down here. Obviously, we're going to traction up here, take as much pressure off this area, traction on his lower back, and get this to release. So I'm going to kind of bring it this way and just kind of keep it neutral. Nice. One more time. Let's go ahead and have you go on the other side. So same thing, gonna push up, down, and up. Nice, just like that. Breathe in, and out. You okay? So I think most car accidents, whiplash is something that we have to take into consideration. This kind of lifting adjustment I do after a car accident is actually better than the typical standard chiropractic adjustment you might see. Biggest reasons is because the muscles and the ligaments of the neck work up and down in this y-axis direction. When we do this lifting, we're not actually creating any more additional rotation. It's just traction. And so patients get a lot of relief just by doing this kind of cervical manipulation alone. So what we're going to do is just go straight up. Raise your chin up here. Something to keep in mind if you do have injured ribs, two things. Number one is that ribs take the longest to heal of most bones that are fractured in the body. If you need some additional support, get a wrapped bandage, wrap it around that torso area. Don't make it too constricting, but get that a little bit additional support. And definitely at night, putting some ice on there, that'll help decrease the inflammation. So before DeLorean gets up, getting up is going to actually contract a lot of these abdominal muscles, including these intercostal muscles. Sometimes it's better if the patient rolls to their right or left and then gets up rather than just coming straight up the table. Okay, so if you do that, whichever works best for you. Perfect. Okay. Also from the car accident, with a hand on that steering wheel, had a little bit of impaction, some damage to your shoulder, correct? So this is a very easy technique we have in one of our YouTube videos already that's very effective, and we'll show you how that's done right now. Hand on the femur's head, wrap around, push back the elbow. Easy peasy. And go.
It always feels weird like lifting now because like things are like readjusting.
Yeah.
It's taking a minute to get used to.
It does. Yeah, but if anything, it'll be just structurally better overall. How you feel?
Sweet, good.
Nice. You're definitely still in pain, progressing, and we'll see how you are in a couple weeks from now.
Sweet.
Perfect.
Thank you.
Thanks, man. Yeah, thank you.
Hey, my name is DeLorean McMullen. I've been coming here with Dr. Randy Cracks at Innovative Chiropractic since May of last year, 2024. After I was in a car accident, I got T-boned and I nearly died. And I've been thankful enough to be doing jiu-jitsu and sports and staying physically active thanks to Randy. My lower back was experiencing, quite a bit of pain, and I had that since high school and rugby. And then recently my knee, I tore my ACL about 3 years ago, ACL and meniscus. I come into the chiropractor, come to see Randy, weekly since the accident, and still now. It's been great. I've been feeling better every single day. And the funny thing is it kind of improves your mood too when you come to the chiropractor. You just just kind of twists you up and you feel better. So if you guys are thinking about getting chiropractic help, I would 110% recommend you to Innovative Chiropractic.